Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
I thought you
Bob.
forgot your name there for a second, Brad.
I was breathing.
Okay, today, Brad, we're going to talk about a new treatment combination for back and neck pain. It's kind of a 1-2 punch.
Right.
And this video, again, is being done in cooperation with FAMOUSPTX. And that's a company that manufactures products that are provide far infrared heat.
FAR.
Yep.
F-A-R.
I think it's on the spectrum.
Sure.
That's what they're talking about, FAR.
Right.
This is a family that's been, a family-owned company, so we like that, right? Because we're kind of family, right, Brad? I consider you my family.
Exactly.
And they've been around for 21 years. They're from Calgary. That's in Canada.
Yep.
And they have all their products, by the way, are registered with the FDA and also with Health Canada. So these,
Right.
they're legit.
They're not fly-by-night. They're,
Right.
they've been around for many years. This is not just a 4 or 5 year company,
Exactly. Precisely.
Precisely.
So before we get into that, Brad, I see we have a couple new people here.
Once again, they're coming in, Bob.
Yeah, in droves. If you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to the Facebook and like us because Brad and I have a severe need to be liked.
Yes.
All right, let's get talking about what we're talking about here, Brad.
Yeah.
The first thing is the treatment combination is going to be the use of infrared heat to calm things down, get your pain levels down, and then you got to figure out which specific movement's going to help you.
Right.
And that's what we're going to help you find out today.
Right. This deep heat is not only going to calm it down, but it's going to increase the circulation and help relax the muscles. To, like you said, it's a double punch. We're going to do some gentle stretching to get things moving more and add that heat so it's more pliable and just a natural relaxation.
It's going to make it a lot more effective,
Right.
the stretches that you're going to do. And by the way, I got to confess right now, Brad, I can't even wait any longer. So FAMOUSPTX sent us 2 of these to give away. And we made this promise. One of them is this, what they call the big slipper. You can put your feet in it, and it works out really cool. And we are going to be giving one of these away.
Yeah.
But they also gave us one of these, and we're not giving it because Brad took the other one.
Yeah.
And he's got it at home. This is actually yours.
Yeah, I use it on my recliner.
Yeah.
In the evening when I.
And so during this last week, I had kind of a little episode of my back was hurting a little bit from sitting too much, and I took it out. And I'm like, I'm sorry, this baby's staying with me. So we're gonna give away one of these, and we'll give away something else instead of this. I mean, we'll stick to our promise here. But sorry, FAMOUSPTX, but your product's too good. I mean, that's just a problem.
All right, let's go.
All right, let's keep going. All right, let's talk about far infrared heat, Brad. Why do we like that better than regular heat? With regular heat, the penetration is only 2 to 3 millimeters.
Right. It gets through the skin, and that's about it. Particularly
Very superficial.
Yeah, yeah. If you're going to go through some, fat and some muscles, and you want to get in there
through the tissues,
it's not gonna make it.
It's not gonna, especially when we're talking about back and neck pain that may be arthritis. It's not heating up the joints. It's not getting down into the joint itself.
Right.
And your back is filled with joints, and so is your neck.
Sure.
So this, instead of going 2 to 3 millimeters, goes up to 60 millimeters, which is 6 centimeters, which is
2.36 inches.
Yeah.
Or 2.63.
No,
well,
2.36.
Okay.
And so that's a good deal of penetration. And they do have other products. We're going to be talking mostly about the platinum today, because the reason I like the platinum is because you can use it on any joint.
It's the most versatile.
Yeah, it's the most versatile. But they do want to have one for the feet. Like we said, we're going to be giving one away. What's nice about this, because it goes on all sides of the feet, it's going all the way through the foot. I mean, that's that's how it's going to work. It's got one for the wrist. And again, because it goes 2.36 inches, he's modeling there, it's going to go all the way through the wrist. And the same with, they have one for the knee right here. Sorry, get a little sloppy here. Because it goes all the way around the knee, it's going to penetrate all the way through the knee. So
Right.
it's hard to beat that type of penetration. So we're going to use the platinum one today, and we're going to use it. We're using it with the spine, basically, neck, mid back, low back,
Right.
and what you should try with it. Let's start off with the neck, Brad. The way I like to do the neck is, by the way, there's 3 panels on the platinum here, and you have the hard panel always goes to the body, because that's where it directs to the far infrared heat.
And that's very clear. the 3 panels are the 3 heat sources of the infrared.
Like you said, the wording is on this side,
Sure,
isn't it?
yeah.
So I usually just slip a little towel under here, rolled towel, and now I can lay on it and see how it gets into the crook of my neck. Now the thing about this is, and this one's already heating up, you don't have to have it conform completely, because the way the infrared works, it'll penetrate even if even if there's a little gap here, it'll still penetrate into the neck.
Right, you don't
And
have
that's
to
what I
wrap
like about it.
Yep, precisely. You know, and if you want
A little pillow.
Yep, you can get that for some support. And then, you know, you should feel relaxed there. Now, if you have a tight neck, you're here, you might be able to rotate your head right to left.
Yep, you might start working on the rotations and figuring out, does one of them feel better than the other?
Right.
If
In
you-
other words, to the right or to the left.
Yeah, if you find out it feels good to the right, keep doing to the right. If it feels good to the left, keep doing to the left. If they both feel fine, do them both.
Back and forth.
Yep. Now each Thermatex comes with an 8-foot cord, which is you said this is an industrial cord, right?
Yeah,
Brian?
these cords they're nice cords.
And it's got just a little switch that you turn on, and are we on already? Yeah, we're on.
Yep.
And there's no rheostat or anything like that. It's a one heat setting, so it's the same comfort every time. I know that some of the people at Thermatex talked about that they were using this just as a source of heating up in the winter when it was
Right.
cold. They'd put it in their chair, so it's
Not necessarily therapeutic, but it sure felt good.
right, right. And they recommend that you, for treatment sessions, they talk about having it on for almost 45 minutes because it takes about 10 minutes to heat up. And then the benefits, are going on for 30 to 35 minutes and twice a day.
Sure.
Now it seems like a lot, but this is very easy to use. I mean, you can put it on. I use it like just laying in my chair.
Right.
So you can get up to the neck and you can watch TV while you're doing it. So it's just real convenient.
Incorporate it with your other activities.
Right. So let's say you get done heating up the neck a little bit. You were doing the rotations. Now you can also do, Brad. I like to put this roll towel right here, and even just do a little bit of chin tucks. So you're going like this, and now you're tucking your chin in like this, and this stretches out the upper part of your neck, and it's a good one to do before you do some of the other stretches on the neck. It just helps get that neck into the correct position.
Right. And once again, we might move this up a little bit. There you go. And you might lay here for 15 minutes, enjoy the warmth, let that heat penetrate in, get the circulation, the muscles relaxed, and then start doing the chin tuck.
Yeah, this actually feels really good right now. This is, we got this baby roaring now.
You want to stay there and I'll finish the video?
No, I'm gonna earn my pay here, Brad.
Okay.
All right, the next one, Brad, that you do quite often is cervical extensions.
Right.
This is the one that we like to use with a lot of people, is working on going back like this. And especially after you heat things up with the Thermatex, it works out really well, that it feels nice and loose. If it doesn't work out well, I know what Brad's grabbing already. A lot of times you can take a towel, and this might help, because if this hurts yet, you don't want to do it.
Right.
You want to go just into the range that it feels fine, and then you can go like this even, take the towel, pull down, and go back like this.
Yep.
And sometimes we even go like this
Yep.
along with it.
Yeah, a little
So,
traction, so to speak.
all right, let's go to the next one, Brad. Let's
Okay.
go to the mid back.
Mid.
Let's some suggestions on that. What's nice about this is it comes with 2 straps, the Platinum model, and you were going to help me, Brad.
Yes. You can do this by yourself.
You can do
It's
this
really easy.
yourself. I just didn't want to do it under pressure by myself.
Yeah, he gets nervous when we get on the video. And
Let's go all the way up in the mid back, Brad.
yeah, well, here, let me help. It's going to be easier if we go this
Oh.
way, just because of the cord.
Yeah, you always want the cord going away from your body.
Right.
So,
But I remember the term. These are hospital grade cords.
oh, they are.
Yeah, they're heavy duty.
So now I'm getting into the mid back,
Right.
and plus I can be a little mobile because of the large strap
so
here.
we're going from the lumbar all the way up, halfway up the thoracic here.
Yeah. So we're getting that mid-back thoracic area here. And what you can do with this is, of course, you can work while you're doing this. You can sit in your chair, you can talk on the phone, you can do all these things. And then what I like about this, Brad, is this is the common movement with thoracic problems, is you can just lean back like this Oh, this is a really great combination, Brad.
Right. So you're getting some movement, some stretch, and you have direct contact with this deep infrared heat, and you know what? It's wonderful.
Yeah, this is the 1-2 punch, Brad. This is going to knock that pain right out.
Oh yeah.
All right, let's go to the low back, Brad. So obviously you can just lower this down a little bit. Now we're getting into the lumbar area here. And one you can do is, again, with it all in place like this, Brad, you can actually, I want to make sure my cords are out of place though. They're kind of on the wrong side, aren't they, for this? Let's go this way.
Yeah. There you go.
All right. One of the standard motions that we have people do is hook line rotations.
Right.
So you bring your legs up like this, and you're going to rotate back and forth like this.
So what we're doing here is the pelvis is rotating, and then the shoulders stay still. That way the lumbar spine, that L4, 1 through 4, or 5, I mean, they're getting a little rotation, getting those muscles to relax and loosen up.
Yeah, this is one almost anybody can do,
Yep.
especially with this combination. Boy, that's heating up really nice, Brad.
Yeah.
There's a reason why I stole it.
So what it's going to do, a lot of times you can go one way and it feels fine, and then you go back the other way. And
Ow, ow, ow.
Yeah, so you're not going to push through it. You know, it's not a no pain, no gain. It's
Right.
work with it. Then go here and stay within the pain-free range. And after 5 or 10 repetitions, you're going to go back and test the painful way.
And you might, yeah, you might be able to gain some more.
Go a little bit further. You'll gain some range.
Now, if you have spondylolisthesis, or you should be proud of me, I said it right.
Spondylolisthesis.
And spinal stenosis, or if you even just have regular arthritis,
Yep.
a lot of times this one's going to feel fine too. Maybe do a single knee to chest, and then you can also bring the other one up and do a double knee to chest. Again, all while the Thermatex is in place.
Sure.
Works out really nice.
Yep. Gap in those facet joints going to open up so the nerves are not being as pinged. It's just a wonderful way to relieve that stress in there.
So you're going to find out yourself which one works for you. I mean, if none of those work, then here's another one you can try. So we're going to show you the extension.
No two backs are alike, Bob.
That's right.
No two spines.
All right, this is one. Again, I got to go this way now, right?
Unless you're spineless, but that's not us. Yeah, see, at least Bob laughed.
All right, you got someone to laugh. Again, what's been nice about this, I've been able to do all these with it in place.
Yeah.
So you can actually do it during that treatment time period of the 25 minutes, or after it heats up. But you can start in this position. This is for about 80% of the backs out there is going to feel good. And you're going to maybe eventually get up to like this for a while. But then finally, what you're going to work on is keeping the pelvis down, hands underneath the shoulders. You're going to do what we call press-ups, like this.
And this is where this Velcro, the elastic strap comes in handy with the Velcro. Because if you did this with just a hot pack, or if it just didn't have that, it'd fall off.
Right.
It's very irritating.
So this is going to really heat up and really make it maximal for you to stretch out the back while the Thermatex is in place. And by the way, Brad, we should mention, Thermatex is they're offering generously to a discount for people, but it's only till September 30th. So
I thought you were going to say midnight tonight.
Yeah. We got a little bit late in making this video, and so we've had some other videos for them, but look in the link below, and you can take advantage of this before midnight on September 30th.
I hope we don't get in trouble.
Yeah, I hope not either. But this is a great one to do. Same thing again, Brad. If it hurts, go up to this point, and then eventually work up a little bit farther.
Sure.
And it's going to provide the support you do. That gives you some things to try. That gives you some things to work on. And my back's in great shape right now, Brad. Because
I believe it. You're probably ready to go up there and run a marathon.
Yeah.
If you had a little generator, you could drag it when you're running and have that across your back.
Thermatex, that's the next thing you need to come up with, and make a portable one.
We never end up with that. Maybe you could put that around in front and we could help fix
Oh, that's right. Brad and I can fix just about anything except for a broken heart.
Yeah, put that up there.
I don't know if they're going to recommend that, Brad. It's probably not recommended right now.
Oh, Bob.
Over the chest cavity. So, all right, thanks for watching.